When you break it down, there are essentially three categories of patients in the emergency room, and this message is for group number 3. I'm an emergency doctor. Group number 1 are the patients who absolutely need to be in the emergency room. They have a critical, life-threatening condition. These are the patients who should not have to wait too long. Obviously, you may be seen faster if you're having a severe heart attack versus if you have something like appendicitis or fractured wrist, but all of those things absolutely need to be seen in the emergency department. Category 2 are the patients who simply don't have access to outpatient care. These are the people who are coming in with problems that are non-emergent, but they have no other way of getting their care. Unfortunately, it doesn't always mean that we'll be able to provide the care in the emergency room because it's not always the type of care we're capable of providing because of the resources that we have. But that's why those patients are in the emergency room. And category number 3, and this message is for you guys, are the patients who have no life-threatening condition. They have good outpatient follow-up. Often they even have that outpatient follow-up scheduled already. But they are too impatient to wait for it, and so they show up in the emergency department instead. I literally have patients on a regular basis who tell me that they have a primary care appointment tomorrow or their specialist appointment next week, but they could not wait any longer, so they are in the emergency department because they want their care faster. Group number 3, you guys gotta stop, please. I am not trying to minimize the discomfort that you're in, but when you already have access to the appropriate care and in the appropriate time frame, and you're just coming into the emergency room because you're upset that it can't happen faster, that feels really unfair to the other patients, certainly the ones in category 1 and also the ones in category 2. So at the end of the day, you are always the best judge of whether or not you need to be in the emergency room. And whenever you feel that your condition is emergent, of course you should go. But if you feel like you're going just because you don't feel like waiting, that is causing a lot of challenges and delays within our healthcare system. More and more often, it seems like we see a good number of patients who are there because in today's world, everybody wants what they want and they want it now, whether or not it hurts or impacts anybody else.